Welcome, everybody. Thanks for listening to our recording for the week. We have 3 chapters we're doing this week. I'm going to go over the PowerPoints from the book to help us guide us in our reading. Remember, next week is Thanksgiving. So I sent you guys an email. What I expect from you is to attend one of the other teachers' classes, or you can listen to a recording if you would like me to do a recording for you. I'm happy to do that. So let me know either way what your plans are as far as next week. Happy Thanksgiving to everyone. I hope you enjoy it. You take a break from nursing school and everything is as you hope. Everyone's happy and healthy. All right, so this week you guys handed in your group assignment. It was infectious diseases, and I'm happy that you did that. That will correspond to one of our chapters tonight, actually 2 of them. So I think you guys probably have done a lot of learning this week prior to this lecture. I will probably lecture for about 30 minutes tonight. It will cover our PowerPoints from the book. And I'm going to ask that if you have any questions, you reach out to me if the recording is not clear or you're confused about any of it. Remember, next week, there's several chapters to read. I want you guys to focus on the reading best you can. I'm going to also post a recording that Professor Apple did about windshield survey. And the thing with that, I want you to watch that. It covers the content from last week that we didn't cover after the exam. And it's really cool. She does a windshield survey of Hawaii, and it'll really touch on community assessment, what we're looking for, and things like that. We will be having an exam review as well. I'll let you guys know dates and times for that prior to our 3rd exam, but we're halfway through, more than halfway through. So good work. You guys are working hard. I've reached out to you if I'm concerned in any way regarding grades. I've been in touch with our deans as well. So if you've been contacted, then you know who you are. All right, so we're going to take a look at our first chapter tonight, which is going to be chapter 25. I'm going to share my screen with you so that we can all look at the PowerPoints together. Hold on one second. There we go. All right, so 25 is going to be violence and human abuse. We could talk probably a whole semester on this. What I want you guys to focus on, though, is abuse and what we look for when we see it. So if we look at our introduction, we remember violence is going to be non-accidental acts, interpersonal or intrapersonal. Violence is a concern among us as nursing community nurses, particularly because we are going to assess for that. We're going to look for signs and symptoms that we may see, know that we have mortality and morbidity that's going to result from that. We oftentimes will care for our patients and we'll get some clue. And I can tell you, working with the young population, usually kids are really good at this. They will tell you what's gone on the night before. They'll say, oh, I have a stomach ache. And then, you assess a little bit and then they say, well, this is what happened. And I had a student who came and said, oh, well, my dad punched me in the eye last night at the store, and that's why my eye is black. So things like that, you're going to pick up on. And of course, when you hear things like that, you're going to make sure that you assess deeply and see more about that. Do know as nurses, we're mandatory reporters. So that is going to mean we are going to report any violence or abuse that we suspect. We then leave it up to the state. And for the state of Colorado, it's Colorado Department of Youth and Family Services. So almost every state has something like that. When we report that, then they designate who goes out to assess the violence or abuse. No, oftentimes with children and elders, they may say that their mom or dad is being abused when it's really they are, because they're trying to protect the perpetrator. Know that we look at our social and community factors that influence violence, like our work, what's on social media, religion. Some religions treat, women differently, things like that. Look at our facilities. Know that when we look at social and community factors, work, oftentimes we see work can be fulfilling, but it also can be a source of a lot of stress. And so that may lead to violence in the home. So remember, sometimes, and you guys know being nursing students, how it feels when you're frustrated and you probably take it out on, a family member, and maybe you're a little more unkind to them than normal. Hopefully there's not violence there, but just think about how stress impacts us every day, and how some people handle it one way and others don't. So really think about that. Think about what we've been through with COVID, the stress of that, the economic stresses that we see. Know that schools do take responsibility that's assigned to the family, like education, discipline. You have to be really careful as a school nurse. I will tell you that you have to be sensitive that some religions, some cultures may believe in hitting children and don't think that that's a form of abuse. So we're going to remember our cultural sensitivity with that. We're teaching kids when they're young, violence is not the option. Bullying is not acceptable. So we start that all the way in kindergarten or preschool. When we see anything like that, we address it as soon as we can. When we look at our media, our television programs, articles, abused women and victims will often benefit from the media and see things like that. Organized religion, usually it's going to teach nonviolent conflict, but there are some traditions out there where victimization of women is acceptable, and it is something that the women tend to grow comfortable with because that's all they've known. So we want to use those cultures when we come across that, make sure we're real sensitive to it and address it so that we can provide education. That's going to be our key as our community nurse. Lack of jobs, low paying jobs, low income, we're going to see an increase in violence. We're going to see people trying to cope with this, not having means, so they're going to oftentimes use violence as a solution. Remember that some people who live in a more desirable place and have more availability to community services or may have some more support systems that our lower income families do not have. Keep an eye out on your playgrounds, your parks, swimming pools, where we might see aggression. We talk about a lot, and this is a big keyword among our child population, but know that we need to focus on this for the adults as well. We look at violence against themselves or certain individuals. So we know that sexual violence is, when we force a person to take part in something that they are not consenting to. So you have to be really careful when you're assessing that. That's a real sensitive topic for a lot of people. So when we're assessing for abuse in the home and the community, we're going to be real careful how we present that. Suicide is going to be another one. And unfortunately, we are seeing a rise in that, given COVID and things like that. The frustration, the stress that we talked about is why. So there's different types of family violence. We see physical, sexual neglect. Oftentimes neglect will be, the kid comes to school, doesn't have any food. You call mom, say, what's going on? Can we give you some resources? Oh, no, we're fine. And then the kids report, oh, no, we don't have any food in the house. So you really have to be like a detective when you're looking at abuse and be very, very sensitive to it. We talked earlier about older adults, financial abuse that we see among them. Some signs of abuse are going to be really, there are so many of them, but when we see anything like defending behaviors that might otherwise be seen as harmful, they usually will protect. Children, like I said, are very clear. They will tell you. They don't, particularly young ones, they will tell you because they don't know there's anything wrong with what's going on. But we look for bruises. We look for cuts on the skin would be a self-injury one that we look for. Older abuse on older adults, we talked about financial stability and how that impacts. Our interventions as a nurse, we're going to identify victims of family abuse because sometimes as a nurse, they will confide in us when they won't confide in others. We're kind of a safety for them. We're going to make sure that we're looking at the individuals, the family, and the community anytime we hear of an abuse situation. Remember that families are impacted by many different things as a community group. So that's about, I could talk for days about abuse, and we will talk about this when we're together as a class, some examples that I've seen and what I was able to help with. Sometimes it's very transparent. Sometimes people are looking for help when they're under abuse. Sometimes, like I said, children, they don't think there's anything wrong with it because it's all they've ever known. All right, so that covers our section 25. I know I covered that quickly. There's a lot of content in our book on it. I'd like you to really know with abuse and violence some of the signs and symptoms and therapeutic ways that we can go asking for assessing for abuse. And you want to do that every time you're with a client, regardless of a history or not. Okay. We look then, our next two chapters are going to be infectious disease control and prevention. I'm going to add a YouTube video on here that I want you guys to watch. It's really good. It goes through the different ways we can look for disease prevention and control. Living in COVID, this has been a great example of how we have really been meticulous as a society, more so than normal, about, cleaning surfaces, washing hands. Our number one defense is always going to be washing hands. So that's important to know. With sexually transmitted diseases, we're going to be teaching at a young age, middle school age, type of protection we would use and things like that. So when we look at our objectives for this, we really want to look at the threats of infectious disease and how the epidemiological triangle, which was our agent, our host, and our environment, how do they act together? We're going to look at examples and how we approach them. So we have a worldwide concern about infectious disease. What's happened is our country is a melting pot. So people come from all over. And when they move from one place to another, they bring diseases with them. And then the immunity and resistance and viruses, they can emerge and they can change. Just like COVID, we now have variants because of what's gone on. So we see that all over with all of our infectious diseases. Just know that in the 1900s, communicable diseases were the leading cause. By 2000, we had an improvement in our nutrition, our sanitation, our vaccines, antibiotics. I will not get into a topic on vaccines because I think as nurses, what we need to do is educate the public that if they are being recommended, then they're being recommended. We have to be real careful with our biases. We don't put those in there. All right. So what we've seen really as time has gone on is our chronic diseases are a bigger problem than our infectious diseases, but know that they are still the number one. When we look at transmission, we'll talk about our agent, our host, and environment. Remember, our host is going to be what person is going to get the disease. Our environment is where have they been, what have they been exposed to, and our agent is going to be that virus. Okay, so we have different modes. We have vertical, horizontal. We know horizontal goes side to side, vertical goes up and down. We look at disease development, endemic, epidemic, and pandemic. Do you know the differences between those three? When we surveil, we're going to gather who, when, where, and what. Now with COVID, this is a good example for infectious disease, just because we're living in it right now. So now what the states like to do, and I fill these out daily, is there's case reports and they want to know, where have you been? What were the symptoms? Who have you been around? It's really hard because it's a 10-day window. So most people are around a lot of people in a 10-day window. So you just want to really focus when you're surveilling. Know that our diseases are reportable state by state. You can Google your state and infectious disease. And in the state of Colorado, it's Colorado Department of Public Health. So you guys all have something like that. I know Florida does, and some of our students are in Florida. So we also look at what are the emerging infectious diseases, those that has increased in the past 2 decades. The Ebola virus has been one. We've had HIV, the H1N1, West Nile. We've had COVID. We've had all kinds of different things. So just know which ones are up and coming. And you guys did some research on that. When we look at how are we going to prevent them, how as nurses are we going to do it? Our primary prevention is going to try to reduce. So remember, primary prevent. We're going to prevent or reduce the incidence of disease by preventing it before it happens. For our secondary prevention, we're going to surveil to try to decrease that spread, and tertiary, we're going to treat. We're going to work to reduce the complications. So our role really is to control, teach, monitor, and treat our patients. It talks a bunch about bioterrorism in our textbook. I'm not going to spend a whole lot of time on that. Just know that bioterrorism is out there, which I know you guys know that. I wouldn't spend a whole lot of time focusing on that section though as well. All right, so when we look at our vaccine preventable, we have our measles, rubella, pertussis, influenza. So we have a certain schedule that we follow with kids, and it's federally given. So when they're born, they'll get a hepatitis B. When they're about a year, they will get, before a year, actually I think it's 2 months, they get DTaP, which is diphtheria, tetanus, and pertussis. And then they'll get a series of those. They get 2 of measles, mumps, and rubella, and 2 of varicella, which is our chicken pox. What ends up happening, know that we're immunized about for a bunch, but just know that is something that we look at and how we can control that and teach our clients about that. Foodborne and waterborne, we got salmonella, E. coli. We hear that in the news all the time. You know, we see it spreading among meat production facilities. We see outbreaks and pathogens. Our vector-borne are going to be the ones that are transmitted by a carrier. So like we see Lyme's disease, which is going to be by our ticks. That was a big one. And, you know, we want to look for our signs and symptoms of that. Rabies is another one. You'll know if a client is bit by an animal, that we're going to check for rabies to make sure that that is not being spread. We look at parasitic diseases, you know, some that are opportunistic, meaning that they look to grab onto things. And disease of travelers, we see going out of the country. United States needs to really take a little more precaution, but we know that we need to be careful with things like malaria, foodborne and waterborne. You see a lot in Mexico. They'll give you bottles of water to drink as opposed to drinking out of the faucets, and then diarrheal diseases as well. We know that we have healthcare acquired infections that are acquired during hospitalization, like a MRSA. They involve patients, healthcare workers, visitors, anyone who's been in contact with that facility. And we are always going to use our universal precautions. And you guys should know all about those from your med-surg time. And I want you to focus on what you're learning in med-surg and apply it in the community setting. Okay, so infectious disease and control. You guys did a lot of research this past week with your group projects. I want you to remember what you learned about transmission, how they are born. You will not be tested on the discussion post that you guys posted, but you will be tested on, you know, healthcare, transmission of, you know, infectious disease. So, and our last chapter is chapter 27. And on chapter 27, we're going to look at HIV, hepatitis, and sexually transmitted diseases, as well as TB. Think back last week, the week before last, we talked about TB, where that's spread in close quarters. We're going to look at these diseases that are acquired through behaviors that can be avoided or changed. So individuals who live with these chronic infections, of course, can transmit. With HIV, 1981 was our first report of it. One of the biggest public health challenges. The lifetime costs are enormous. What we do know about it is there is some treatment for it. And so the primary infection usually occurs about a month, but it can last up to a year. You're going to have that exposure to the blood, semen, vaginal secretions, and breast milk, not transmitted through casual contact. Well, this is kind of a review, guys. I know you know this, but I just wanted to cover what you guys are reading about. Know that worldwide 38 million are going to live with it. 2/3 of those live in Africa. So something really important when we're assessing a community, you know, if you have a client that's moving from Africa and it's so predominant there that they may look at it differently than we do here. Heterosexuals account for 27 of new cases since 2009. We know we can do an antibody testing. We will counsel anyone who's sexually active to have that type of testing. Negative, we're going to make sure our clients understand evidence of an 6 to 12 weeks before evidence of an HIV antibody, and we're going to counsel when they do have it. Right now, we are doing a lot of research in this country on HIV, and hopefully, and I know it has, the more easily transmitted. We see it more easily treated than it was previously, so that's important. On our sexually transmitted diseases, we have gonorrhea, syphilis, chlamydia, herpes, and HPV. HPV, we do know we have a vaccine now that's offered to 12 and above. So that's a good one that we help to try to prevent. All these are being transmitted sexually. So you want to teach our clients safe sex practices, protection, getting tested if you're with multiple partners and those kind of things. Hepatitis is another one. We have a hepatitis B vaccine right now. Hepatitis C is on the rise. Know that it's spread through blood or body fluids, but it may not be, you know, not all of these diseases are going to be in clients that we may assume, but if they're using not safe sex practices and things like that, we want to make sure about that. Our Hep A is going to be our food transmitted. Our Hep B is going to be spread through body and blood fluids. Do know it can survive for at least a week. So even if you clean it off, If you're not using the right disinfectants, and if you work in a hospital or long-term care facility, you should have special wipes for all these infectious disease. But no, it can live at room temperature for at least a week. Our Hep C we just talked about, it's on the rise. And then we go to TB. TB, we're seeing skin testing. We all know, we probably have all had that, where they put a protein in your arm, you watch to see if it grows, depending on how big it grows. And then if it does grow to a certain size, then we will do a chest x-ray. Emergence of multi-drug resistant TB has prompted the use of directly observed therapy in the United States and other countries. So what we want to think about as a community nurses, what are we going to do to help our patients? We're going to counsel, we're going to educate safe sex. Our drug users are going to be at risk for our hepatitis B and our HIV. We do now have great things out there to prevent the cross-contamination and reusing of needles. There's places where you can dump needles and then they will provide clean needles for you. So we're going to teach about that. We want to be an advocate. We want to tell them about, you know, these are the places you can go. This is what you have. Remember, we're going to be careful with our biases here. Why people choose to do what they choose to do is their business. As nurses, what we do is we help them cope with what they have. Okay, so please remember that when you're in any setting like this. I will tell you, in labor and delivery, for example, the standard of care is to check a mother when she's first pregnant and then check her again at 28 weeks for HIV. And I have encountered many patients who have been negative at initial testing and then positive at 28 weeks. So just because a lady's pregnant doesn't mean she's not having multiple, you know, sexual encounters with different people, or their partner is not doing that. So you have to be really careful with that. You're going to do a lot of teaching. You're going to do primary prevention. We're going to be teaching those young kids safe sex, no drugs. Once they are in it, and we're going to be surveilling our risk factors for, you know, who are at risk factors. Our vulnerable populations are going to be at higher risk factors, sometimes depending on their life choices. And then, you know, with our tertiary, we're going to really teach them, how are we going to treat it? This is the drug regime. It is difficult. You know, it is expensive. We look at that. Our federal funding insurance is not always going to cover the best, but they will always be able to treat these. So we want to teach that to our patients. You guys did some work this week. I hope you read each other's about your infectious diseases, communicable and infection diseases. And you'll learn a lot. I really enjoyed reading the posts. They were very thorough. So that covers pretty much what I wanted you to know for this week. It's the 3 chapters that we spoke of, 25, 26, 27. Do your reading on it. And we will talk about which infectious disease during our study time. We will talk about exactly what I want you to know, but this is a broad overview. I am also going to post a lecture, like I said, from Professor Apple, which discusses community assessment in her windshield survey. I do want you to watch that because that will cover the 2 chapters we were unable to cover after our exam last week. I'm here for you. Reach out if you need anything, text me, email. I'm happy to answer you. We are more than halfway. You guys got this. Any questions, reach out. I am available. If you want to go over this content in more detail, let me know and we can do a one-to-one. If you want to help start preparing for our exam 3, I can do that with you as well. So reach out. Have a great week. Happy Thanksgiving. Enjoy your families. Don't stress about nursing school. We have no exams. Yippee! So let's do our best to get it together. Again, next week, Thanksgiving is Thursday, so I do want you guys to make sure that you are going to another class, or if you want a recording from me on the several chapters that we have reading. Let's take a look at what we have due this week as well. I'm going to stop sharing just there for a second. Oh boy, my screen is so dark. Sorry, guys. So I'm going to pull up our assignments that are due this week. Please make sure you get everything in. This really helps. As you know, I turned on the scoring for you guys for your homework and assignments, and I think that was really helpful. So I'm going to share our modules for this week. We're looking at week 7. This is what we did this week. We did our group project. We're going to do our peer review by Sunday. We're going to respond to 2 groups by Sunday. Next week, we're going to be preparing for disaster planning. This week is pretty low-key week. Next week is a ton of reading. So if I were you, I would split the reading up, do 4 chapters beginning of the week, 4 chapters at the end of the week. We're going to have another case study, disaster planning. We're going to have NCLEX review next week, and we're going to have live lecture. Live lectures should be 24 hours after you attend the lecture. Let's take a look at our live lecture questions for this week. When discussing family violence and abuse, what are the signs of abuse? I want you to read that in our chapter. There's several different ones that they talk about. We talked about our 4 emerging infectious diseases, and then, state who you saw and when you attended. Okay, so that's what we got going for the next couple of weeks. Any questions, please reach out. I'm here to help, and sorry I got so dark all of a sudden. All right, have a great week, guys. Take care. Bye-bye.